My name is Dr. Richard DeAngelis, and I've been in private practice for 25 years. The scope of my practice is specifically dealing with the early detection of skin cancer and the treatment of skin cancer. And so we see patients of all ages, but predominantly elderly patients, Medicare patients, which we welcome. As I became more and more specialized and my interest in skin cancer became my primary focus, I realized that Mohs micrographic surgery was sort of the up-and-coming thing in the standard of care dealing with difficult skin cancers. And so Mohs surgery is basically a way of not only removing tissue in a conservative fashion, but also it involves actually processing the tissue right there in the lab that you have in-house, and then making slides so that we can actually see the cancer cells under the microscope and map out where the cancer remains so that we can go back and take only what we need. The idea of Mohs micrographic surgery basically is involving a microscope where we actually produce these slides in our lab. Once the slides are made, while you wait as a patient, we basically will look into the slide and see the cancer cells actually under the microscope, and we can tell exactly where the cancer is and where it isn't. What really changed my practice is when I was introduced to dermoscopy, which is basically a handheld tool or an instrument that we use to very specifically look at problems that we can see with our eyes, but not only problems that we can see, but we've even developed a technique where we actually scan the highest risk areas of patients, actually looking for something that you can't necessarily see with your naked eye. Medical education has become key, really, in the development of my way of practice, and so I've learned from some of the best people in the world, and I'm so grateful to my mentors, primarily at Memorial Sloan Kettering in New York City, Ash Margoob, who is really my guru for teaching early detection in dermoscopy, and Ralph Braun from Switzerland. These are two people that I continue to look to year in and year out. I obviously haven't been able to do this alone, nor could any of us do much on our own. And so as I think of my family, my wife, this is an anniversary year for us. Actually, it'll be 30 years, and so 30 years married and 25 years in practice here in South Carolina. And so we're going through some growth pains right now, and we just are opening a new practice in Powdersville, which is a growing area very close to Greenville, South Carolina. And so we hope to continue to grow in a way that we can still maintain our personal touch. But when it comes to a life outside of work, my wife and 4 children have served to ground me, humble me, which is an understatement, and they continue to be the backbone of the reason for waking up in the morning. Really the most rewarding part of my life, not only is it obviously my family, my children that are growing and thriving in some way, young adults now, but when it comes to the practice, it's really all about relationships. And so I think that if you come to us as a patient, oftentimes the problems are intimidating. We try to very comfortably make you feel at home. It is a very family-oriented type environment, and we very much like to make our patients feel like they're part of our family. They're entering into our world where we work. We're quite comfortable in this world of ours, but the unknowns are very fearful, and so we really are sensitive to the types of fears that that such diagnoses as skin cancer can bring to an individual.